Okay, we are talking about low blood sugar. That is called hypoglycemia. Hypoglycemia is a situation whereby the blood sugar is what? Low. Before you will say that somebody have low blood sugar, clinically, there must be three things that will be present. If one is not present, then it is not it. Three things will be what? Present. Number one thing that will be present is that there will be signs and symptoms of hypoglycemia. Everybody here must have experienced hypoglycemia. It is a disease that everybody has experienced somehow. You will feel this weightlessness. Sometimes you feel that you're having too much heat. Heat and about it too much. You sweat so much. Then sometimes your hand might be shaking. I don't know what your village people call it, but my village people call it mbago na. He feels like all is not well. I don't know if he will feel like he will fall if he stands. That is the signs and symptom of hypoglycemia. Then the second thing is that you are going to check your blood sugar level with a glucometer or something, and you realize that the blood sugar level is lower than normal. That is the second thing. The first thing I talked about is there is going to be signs and symptoms of hypoglycemia. Weakness, too much heat and all whatnot. I don't know if sometimes your heart might be beating so fast. I don't know if those are the signs and symptoms of hypoglycemia. Normal. Then the second thing that will happen is that by the time you take Sprite or sugar, anything that contains sugar, or you eat, the moment you eat, instantly those symptoms will disappear. You will see somebody, the body is shaking. You just give that person Sprite. He will drink that Sprite. After some time, the whole thing will disappear. He will become fine. You see, the three things has to be present. I don't know if you understand. Now, what we are talking about is what is likely to cause hypoglycemia for a pregnant woman. Anything that can cause it in a normal person can cause it in pregnant women. Sometimes malaria. In fact, when you want to talk about malaria, you will talk about the things that will make a malaria to be complicated malaria. One of the things that makes a malaria to be complicated malaria is that malaria now have hypoglycemia as a component. So by the time somebody is treating malaria, number one is that the malaria has a loss of appetite as a component. So some of them doesn't want to eat very well. So when you don't take food very well, you are likely to have hypoglycemia. And again, pregnancy, once the sugar level in the blood is small, it's not enough. Nature made it in such a way that they will reserve some for the baby. Just like when we don't have enough food at home. A good mother might say, let the kids eat first, I will eat later. So what happens is that once the blood level is going close to that low range, the body will immobilize, take the food, direct it to the baby first. And that's why those small kids that get pregnant, who are now not eating, thinking that the baby will go out, you will die before the baby. It's not possible. Nothing will happen to the baby now. Because even if there are 30 sugar, the body will take them first, give to the baby. Even when the mother is starving. So whenever there is things that we might think there might be shortage of sugar, there is malaria here, the body will divert all the sugar from the muscle, everything. And it will make you so weak that the muscle will not even want to do any work. Because if they are doing work, they are consuming more sugar. So everything that will make the body to consume sugar, the body will stop it and divert the sugar to the mother. So mostly, you might just have low blood sugar and you are normal. That is not hypoglycemia. For there to be hypoglycemia, the low blood sugar has to be there. There should be laboratory diagnosis, and there must be a resolution of those symptoms when you take sugar. So mostly the cause of this might be malaria. And by the time the malaria is properly treated, then it will go.